This Republican majority has done nothing for working people.
The immediate event is procedural. It is not abstract. It happened on the House floor. Democratic lawmakers accused Republican leadership of delaying action on federal health care subsidies, specifically Enhanced Affordable Care Act tax credits. Those credits expire December 31st. That date is fixed. The consequences are measurable. On the House floor, Representative Jim McGovern spoke directly to that deadline. He said the Republican-backed approach does not extend the subsidies. He said it allows them to lapse. He said millions could lose affordable coverage if Congress does nothing. Those statements are not speculative. The expiration date is in statute. The subsidies were enacted with a sunset. Nonpartisan estimates already exist. If the credits expire as scheduled, premiums could double on average. That impact would reach more than 20 million Americans who rely on the insurance marketplace. That is the baseline. No rhetoric, no forecasting beyond the record. Against that backdrop, a procedural tool was introduced, a discharge petition. 218 members of Congress signed it. That number matters. It is the exact threshold required to force a vote. 4 Republicans joined Democrats on that petition. The purpose was narrow: extend the subsidies for 3 additional years. No broader restructuring, no replacement framework. House Republican leadership opposed the move. Speaker Mike Johnson promoted an alternative bill. He described it as market-based reform. The bill does not extend the existing subsidies. That is the first contradiction. The leadership message is that Republicans support health care reform. The procedural reality is that the only live mechanism to prevent expiration is being blocked. Moderate Republicans acknowledge that gap publicly. Representative Brian Fitzpatrick said proposals to leadership went unanswered for months. That is not a partisan claim. It is an admission from within the majority conference. Months matter here. The expiration date did not appear suddenly. December 31st has been known. At the same time, former President Donald Trump was asked about the issue during public appearances. He was asked about families facing higher premiums. He said Republicans hope to deliver what he called great legislation. Those were his words. He did not provide details. He did not reference the expiring credits. He did not describe a mechanism to prevent the premium increases already projected. That is not a policy plan. It is a placeholder. The uncertainty is not new. The Republican Party has been divided on health care for more than a decade. That history is relevant because it frames credibility. Promises have been made before. Repeal and replace was promised. A replacement was never enacted. That history is not conjecture. It is legislative record. The discharge petition marks the second procedural challenge to House leadership in a single month. That signals internal instability. It is not limited to health care, but health care is where the consequences are most immediate. While this unfolded on Capitol Hill, a separate health-related action occurred at the executive level. An executive order reclassified marijuana from Schedule 1 to Schedule 3. That allows expanded medical research. It does not legalize marijuana nationally. That distinction matters. The executive action acknowledges medical potential. At the same time, the administration has proposed staffing reductions at the Department of Veterans Affairs. Veterans advocates have raised concerns. These are parallel signals: selective engagement with health policy, uneven follow-through. On cable news, Rachel Maddow pointed to states stepping in where federal action stalls. California's governor announced the hiring of former federal health officials. The purpose is to strengthen state public health capacity. That is not symbolic. It is substitution. States are preparing to absorb gaps created by federal inaction. That is the broader context. Back on Capitol Hill, the central fact remains unchanged. Enhanced healthcare subsidies expire in days. A mechanism exists to extend them. That mechanism is being resisted by leadership. Republican leaders say they want reform. They have not moved the only bill that prevents immediate premium spikes. That claim does not survive the record. The immediate harm is identifiable: higher premiums, potential loss of coverage, millions affected. The responsibility is traceable. The decision to block a vote is intentional. The deadline is known. The question now is not whether health care costs are rising. That is established. The question is, who is choosing delay over action when the outcome is already documented? The record does not stop there. The claim collapses when placed next to the record. Republican leadership says it supports reform, but the only live proposal that prevents immediate harm is the one being blocked. The discharge petition does not redesign the system. It does not expand government control. It simply preserves existing subsidies for 3 years. That distinction matters. Market-based reform, as described by the Speaker, cannot take effect if millions lose coverage first. The order of operations is clear. If subsidies expire on December 31st, premiums rise immediately. Nonpartisan analysts say they could double on average. That is not a theoretical outcome. Insurers have already priced it in. Families will see it in January bills. Leadership knows this. The expiration date is written into law. The projections are public. Yet leadership has refused to allow a vote on the extension, even as 4 Republicans joined Democrats to meet the required threshold. That resistance is an action, not an accident. The contrast between what is said and what is done is stark. Donald Trump says Republicans hope to deliver great legislation. Those were his words. Hope is not a mechanism. There is no bill text attached to that statement. There is no timeline. Meanwhile, moderate Republicans say their warnings were ignored for months. That undercuts the argument that leadership is surprised or constrained by time. The delay is the choice. Who enabled it? Party leadership controls the floor schedule. No committee bottleneck explains this. No procedural barrier exists once a discharge petition reaches 218 signatures. The only remaining obstacle is leadership opposition. The consequences are concrete. More than 20 million people rely on the marketplace. Many are self-employed. Many are early retirees. Many are rural. For them, losing subsidies is not a policy debate. It is a budget shock. At the same time, the administration highlights selective health actions like marijuana reclassification, while proposing staffing reductions at the Department of Veterans Affairs. That juxtaposition matters. It shows capacity for action where politically convenient and retrenchment where costs are borne by others. States are responding accordingly. California is hiring former federal health officials. That is not redundancy. It is contingency planning. When states step in, it signals a loss of confidence in federal follow-through. Put together, the picture is consistent. Promises of reform coexist with procedural obstruction. Vague assurances replace actionable votes. Immediate harm is acknowledged but not prevented. That is not gridlock. That is a decision with foreseeable effects, borne by the public. The pattern becomes clearer from here. The pattern is repetition, not deviation. Healthcare deadlines arrive, warnings are issued, and leadership delays until consequences become unavoidable. This is not the first instance. The Affordable Care Act has faced multiple repeal attempts without a replacement ready to absorb coverage losses. Each time, assurances were made. Each time, the coverage math did not change. What is different now is scale and timing. The subsidies in question are already embedded in household budgets. Their removal is not a future adjustment. It is an immediate escalation. The record shows leadership was warned months in advance. Moderate Republicans raised the issue internally. A discharge petition was organized openly. The signatures were counted in public. There was no ambiguity. Yet leadership maintained opposition, effectively betting that time pressure would fracture support or shift blame. That choice produces beneficiaries and victims. The beneficiaries are ideological hardliners who oppose subsidies in principle and donors aligned with dismantling the Affordable Care Act. The victims are identifiable by income and geography: self-employed workers, rural residents, older Americans not yet eligible for Medicare. These groups are overrepresented in the insurance marketplace. That is not partisan framing, it is enrollment data. The institutional implications extend beyond this vote. When leadership blocks a measure with majority support to avoid internal conflict, it weakens the House as a governing body. It signals that procedural power outweighs policy outcomes, that erosion matters because it teaches future leaders that accountability can be deferred by running out the clock. Meanwhile, states are preparing for fallout. California's recruitment of former federal health officials is not an expansion of ideology. It is a response to uncertainty. States do not invest in parallel capacity unless they expect federal gaps. That expectation is evidence. It reflects learned behavior from prior shutdowns, funding lapses, and policy reversals. At the national level, the executive branch sends mixed signals. An executive order reclassifies marijuana to facilitate research, demonstrating administrative agility. Simultaneously, proposed staffing reductions at the Department of Veterans Affairs raise alarms among advocates who measure capacity in clinicians and caseworkers, not press releases. This contrast reinforces the central theme. Action occurs where political cost is low, delay persists where harm is diffuse and delayed. The repetition is the indictment. Deadlines are known. Warnings are issued. Leadership resists the only immediate remedy. The result is predictable harm followed by retroactive concern. Institutions absorb the damage. The public absorbs the cost. There is one final element that has to be addressed. The strongest defense offered is procedural and philosophical. Leadership says extending subsidies entrenches a flawed system. It argues reform must come first, not temporary preservation. That defense collapses under sequence and fact. Reform that arrives after coverage is lost is not reform, it is aftermath. The record shows no enacted alternative ready to replace the expiring credits. No bill text, no scored plan, no timetable that precedes January. Saying reform is coming does not negate an expiration written into law. It avoids it. Leadership also suggests responsibility lies with Democrats for creating subsidies that sunset. That is incomplete. Sunsets are legislative tools. They require renewal when conditions persist. Here, conditions not only persist, they have intensified. Premiums are higher, household costs are higher. The need is documented. Blocking renewal while citing the existence of a sunset is circular logic. Donald Trump's defense is rhetorical. He says Republicans hope to deliver great legislation. Hope does not counteract an expiration date. It does not lower a January premium. It does not explain why a vote is being denied when a majority has signaled support. Responsibility, therefore, consolidates. House leadership chose not to allow a vote. That choice was informed by months of warnings. The foreseeable harm was laid out by nonpartisan analysts. The affected population was known. When harm is foreseeable and preventable, delay becomes culpable. There is no evidence of confusion. There is evidence of intent to run out the clock. That intent is inferred from repeated refusals, despite procedural viability, and cross-party support. The judgment follows from the record. This is not ideological disagreement in the abstract. It is governance failure with measurable consequences. Millions face higher premiums or loss of coverage. States prepare to compensate for federal inaction. Institutions weaken as procedure replaces accountability. The defense that reform requires delay fails because reform was neither ready nor prioritized. The responsibility lies with those who controlled the floor and chose obstruction over mitigation. That is the record. It does not resolve itself. It leaves cost where it always does in such cases. On the public